For about the past 8 years, I had some hip pain, mainly laying down at night, laying on my left side. I would have pain so much that I could only lay on it for about a minute, and then I'd have to change positions, so it was keeping me awake at night. So I came to see Dr. Carter, and he took x-rays and said, yeah, you've got arthritis and you've got bone spurs. And I said, well, what can we do about that? And he said, well, we're going to put you in some physical therapy. So I did physical therapy for probably about 9 weeks, and it didn't get any better. So then we decided to go the surgery route. Dr. Carter explained things to me visually. He printed out photographs of my hip x-rays and things and showed me exactly where the bone spurs were and where the arthritis was and where the bones were meeting bone to bone and why I was having pain.
The type of hip replacement that I do is called a direct anterior approach total hip arthroplasty. The reason that we have started to do them in this manner is the fact that the complication rate appears to be slightly less, and our dislocation rate is also less. There's no muscles that are cut, there's no ligaments that are cut. The muscles are split, and it's what we refer to as a muscle splitting type of a technique. And due to the fact that those muscles aren't disrupted, I think the rehabilitation is quicker and that people tolerate this procedure much better. It's not unusual to have people that are ready to go home, not the day of surgery, but a day or two after surgery, where with the conventional posterior approach, I would say that most of the patients had more discomfort and that they would stay in the hospital for somewhere around 3 to 4 days.
I was able to drive in 2 weeks. I was able to return to work. I had no pain on my left hip, and I think everything went real well. So, and I'm real happy with it.
Interesting enough is that with her first hip, after it was less painful, less uncomfortable, then she began to notice the symptoms in her other hip. So that's why she went ahead and sought my care, and we've managed to try to get her lined up for the end of this year.
He's a wonderful person, has a wonderful attitude, and I just enjoyed coming into the office. The staff is great. Anytime I called, they called me right back, answered any questions that I had, and made me feel at ease. So, and I don't feel any hesitation about having the second surgery on my right hip.